It's a very difficult period for everybody. There's a lot of confusion, lack of understanding on how it's spreading. Though theoretically we know. Remember, our communities live in very communal setups, and it's just not easy for people to separate themselves, or especially after the last first round and the economic slump in tourism sector. Quite a few families have started living together. And so that means to separate spaces is difficult. And outbreak has, of course, caused lockdowns, economic slowdown, and that means people are finding it really difficult to feed the families, but also the pressure on the health system is something that's quite overwhelming for everybody concerned.
And how have communities outside the big cities responded to the situation?
Many families are extremely struggling, and there are lots of organizations that are trying to feed these families. Whoever is able to has some land are organizing themselves in terms of growing food, but it doesn't happen overnight. People are trying to make ends meet in a very challenging way, and I don't think Fiji has seen this kind of poverty or hunger in a very long time. It's just not something that we had ever thought that would come to this.
Well, the Prime Minister, Frank Bainimarama, is resisting a 4-week full lockdown. He's citing, a possible economic disaster and increased isolation. Where do you stand in terms of what the country should be doing with this particular outbreak?
It's really difficult to say. I think we need a lot more communication from the government. You'll see that we're getting a lot of information in dribs and drabs on social media. And one-off announcement, okay, this is, for example, the Prime Minister came out at midnight and said there will be no lockdown. But there's no real time to engage, to ask questions, to understand if there's no lockdown, then how are we going to manage the situation? And if we are going to lock down, because we've seen it has worked in other countries, then it has to come with social protection. It has to come with package for business revivals, for example. At the moment, or the way it has been done, just a lockdown, and then people are hungry and they cannot manage. It's very difficult.
Of course, you are on the record as having called on the government to have a social support strategy. Are you saying the government perhaps isn't doing enough? But because we know that as of last month, it paid out 160 million Australian dollars in unemployment benefits. That's quite a large sum from at least my reading of it.
A lot of that is topping up the superannuation system. And there's very small amounts, $50 going out to informal sector. $50 for food, fuel, medicine, transportation is very little for family to survive. So there needs to be much more concerted effort in what sort of social protection is provided. People are struggling for medication, for baby's milk, which is one baby's milk formalized, for example, $10 for a week. So there has to be much more thought through social protection packages that actually can survive families.
And alongside those social protections, of course, then there has to be protection from the outbreak itself. Would these families that are struggling also support moves for a lockdown, or would they prefer resisting a lockdown?
If their needs are met, I think everybody will go for the lockdown, because at the moment our hospital systems are stressed out. We have hospitals in lockdown. And people are not able to access, anything other than COVID support. There's very little support in some of the other health requirements. So it is in everybody's interest to eliminate the disease or try and manage or mitigate as much as we can. So if the community or the people know how the government wants to do this, what are the plans, what are the social protection, how people can get through this difficult time, people will be supporting the mechanisms.
And moving forward, how do you think the Fijian government is going in terms of vaccinations? We know Australia has already sent 180,000 AstraZeneca doses with a total commitment of 1 million.
We're very grateful for that because with the borders open, vaccination has become very important. We've seen a lot more vaccination in the Western Division because of tourism. People have been wanting to open. Then second highest is in Central Division. But there's a lot more work that needs to be done. And remember, this is the vaccination 1. and it takes another 2 months for us to get the second jab. So this 2-3 months of that period is extremely crucial. And that's the time when we're seeing this spread. Remember, we have a large NCD population, and that NCD population is also extremely high at risk of getting this, and complications can result in severe cases.
Well, Sashi Kiran, good to talk to you. Thanks very much and all the best.
Thank you very much for your time. Much appreciated.